Hello everyone, welcome back to our channel. Today's topic is decoding the hemoglobin A1C. This often mentioned, sometimes misunderstood term is about to be unraveled in our discussion today. We're going to dive into the mystery, the science, and the practical implications of hemoglobin A1C. We'll explain what it is, why your doctor might order a test for it, and we'll provide you with the reference range. We'll also discuss its role in diagnosing conditions and how often it needs to be tested, especially for those dealing with diabetes. But before we go further, here's a little reminder. This video is designed to inform and educate, but it's not a substitute for professional medical advice. If you have health concerns, always consult with your healthcare provider. They're the best resource for your individual health needs. So, what exactly is hemoglobin A1C? Well, let's break it down. Hemoglobin is a protein in red blood cells that carry oxygen from the lungs to the rest of the body. The A1C part refers to a specific type of hemoglobin that's bonded with glucose in your bloodstream. Now, why is this test important? It's because hemoglobin A1C acts like a time capsule, capturing a snapshot of your average blood glucose levels over the past 2 to 3 months. This is a critical factor in managing diabetes, as it helps to give the healthcare provider a more comprehensive picture of blood glucose control than a single fasting or random glucose test. So, in simple terms, hemoglobin A1C is a blood test that measures the percentage of your hemoglobin that's coated with glucose. The higher the percentage, the higher one's blood glucose levels have been. You might wonder, why would a doctor order a hemoglobin A1C test? Well, let's dive into that. Hemoglobin A1C test is like a memory bank of your blood glucose levels. It gives a snapshot of your average blood glucose control over the past 2 to 3 months. This is crucial because the hemoglobin A1C can reveal a more complete picture of the body's response to glucose, rather than a single moment in time that a typical blood glucose test might provide. Now, why is that important? When a doctor suspects a patient might have diabetes, or if the patient is already diagnosed, this test can be ordered to monitor the patient's condition. The A1C also helps to evaluate how well the diabetes is being managed. Furthermore, the A1C can also identify prediabetes, a condition where blood glucose levels are higher than normal but not high enough to be classified as diabetes yet. So this test is a vital tool in a doctor's arsenal for dealing with diabetes. Now, onto the reference range for hemoglobin A1C. The reference range, or the normal range for hemoglobin A1C levels, typically falls between 4 and 6% for people without diabetes. Now, what does that mean? Well, if the hemoglobin A1C levels are within this range, it's a good sign that the body is regulating blood glucose effectively. But what if the levels are too high or too low? If the hemoglobin A1C levels are above the upper limit of the reference range, it may indicate that the body is not effectively regulating blood glucose. This could be a sign of prediabetes or diabetes. On the other hand, if the glucose levels are below the lower limit, it could mean that your blood glucose has been too low, a condition known as hypoglycemia. As well, low A1C could be attributed to anemic conditions, taking anti-diabetic medications excessively, and other conditions. So, to sum it up, knowing your hemoglobin A1C levels and understanding the reference range is a vital tool in managing your blood glucose levels. So, how often should someone with diabetes have their hemoglobin A1C tested? Well, the frequency of testing hemoglobin A1C in individuals with diabetes can vary based on the type of diabetes and how well it's managed. Generally, for adults with type 1 or type 2 diabetes, doctors recommend testing the hemoglobin A1C levels at least twice a year if diabetes is well managed and under control. However, if the person is changing their diabetes treatment or struggling to meet their glycemic goals, testing may be needed quarterly, that is, 4 times a year. Why is this frequency important, you may ask? Regular testing of hemoglobin A1C provides a bigger picture of how well the diabetes management plan is working. It helps in identifying any necessary adjustments to the treatment plan, thus preventing potential complications. In a nutshell, keeping tabs on your hemoglobin A1C levels is a vital part of managing diabetes. Regular testing can help keep your diabetes under control. Okay, we've learned a lot about hemoglobin A1C in this video. Let's take a moment to reiterate the key points we've covered. Hemoglobin A1C, which is often simply referred to as A1C, is a test that provides a snapshot of your average blood glucose levels over the past 3 months. It's like a memory log of your blood glucose levels, and A1C is a useful tool for doctors to monitor and manage diabetes. We also learned that it's not just about checking current blood glucose levels, it's about understanding the bigger picture. This test can help your healthcare provider make necessary adjustments to your treatment plan, ensuring that the patient is on the right track in treatment course. Remember, managing diabetes is not just about avoiding high blood glucose levels, it's about maintaining a balance. We also discussed the reference range for hemoglobin A1C. For those without diabetes, the A1C level is usually below 5.7%. Between 5.7 and 6.4%, a patient may be considered to have prediabetes. And if the A1C is 6.5% or higher, a patient may be diagnosed with diabetes. Always remember, these are just general guidelines and individual targets may vary based on each individual's personal health situation. And how often should one get the A1C test if a person has diabetes? Typically, it's recommended at least twice a year, but it can be more frequent if the diabetes is not well controlled, or if the doctor is making changes to the treatment plan. Understanding the hemoglobin. A1C and what it means to a person's health is an integral part of managing an individual's health condition. It is not just about numbers, it's about gaining control over your health and improving your quality of life. Thank you for joining us today. If you got something useful from this video, please like and subscribe for more informative videos like this one. Remember, knowledge is power, especially when it comes to managing your health. Thanks again for watching, and we'll see you in the next video.